Use this light. It's not fabulous.
I think we're supposed to. Oh yes, we are recording now. That's not too bad. I can see you quite clearly. Can you see me? Okay.
I can see you perfectly. Yep.
Jolly good. I've got two cameras rolling as well for different angles, so that I can chop it up afterwards if I have to. So right.
Okay.
Right.
Presumably you'll you'll cut off the chat at the beginning with me.
Oh yes, that's definitely going. Don't worry about that, because I've got to do it in a sort of formal way, the way I used to do it, the Mediabox. And so we'll go into the interview properly like this. Hannah Bardell, your report is about the way in which people who have problems with drugs are dealt with. Do you feel that at present the system of trying to get rid of it by eradicating the suppliers is the best way?
So the Drugs Policy and Human Rights in Europe, a baseline study, is the title of the report. And I think, to be very direct, first and foremost, we all have to face up to the reality that the war on drugs that was brought in by President Nixon in 1971 has been an abject failure. And coming at it from purely a criminal justice perspective and criminalising and largely marginalising people who use drugs and who are the victims of drug addiction is simply not working. We are never going to be able to completely stop the supply of drugs. There are ways of reducing it, but unless we get very real and very direct about approaching it from a human rights and a health perspective, we are simply going to continue to do damage to societies, to economies, and most of all, and worst of all, the people in all of our nations.
Because they're victims, if you like, aren't they? They're not culprits, they're not crooks, they're people who are themselves victims of the drug dealers, and they need to be treated as sufferers in a sense.
Absolutely, and that's why, you know, in all the evidence that I took from, you know, various academics and experts, the reports that we refer to from the World Health Organization to Amnesty, you know, what we heard time and time again is that the old school approaches, which are largely tailored, frankly, for the tabloid newspapers of the world, are simply not working. And the people who are, you know, suffering the most are the most marginalized people. And all of the evidence points to the fact that quite often those who are most in need and most in poverty suffer, you know, the worst results of a criminal justice-based approach, and that very often people fall through no fault of their own on difficult times and find themselves in difficult situations, and they turn to drugs. And you know, what I saw when I went to Strasbourg to the drug consumption room was a holistic approach. So lots of services there coming together. So psychotherapy, counselling, homeless services, you know, people being able to access, you know, a fair and decent level of care where their drugs would be tested, no overdoses or deaths, or when overdoses were happening, you know, there not being any deaths and people being able to be looked after. And it was an eye-opening and frankly a life-changing experience, because you're able to see how, you know, everybody is treated the same, everybody is treated fairly, and that's what this report goes to. And I think the overwhelming support that I've received at the Standing Committee yesterday, and the fact that the report has now been adopted by the Council of Europe, speaks volumes about the determination and the change in direction of the member states of the Council of Europe. And I'm really excited now about taking on the role as a post-report rapporteur for the next year. And I have lots of plans to write to the Justice and Health Secretaries of all of those nations to engage with them. And that includes in the UK, where we do not have a good track record of approaching this from a health and human rights perspective. In Scotland, we're having a big debate just now about being able to have the power to implement things like drugs consumption rooms so that we can look after our citizens properly. And you look at just places like Portugal, who have the Pompidou Group, who are celebrating their 50th anniversary next year, and you see the incredible work that they have done on this and how they have reduced harm and reduced drug addiction when they have taken a health and human rights approach. So there are other European nations that we can point to, you know, hard evidence to prove that these approaches work, but there is a divergence and a difference all over Europe and beyond, and in the Council of Europe nations, of policies. This brings it all under one roof and says, look, this is a unified approach that we want to take, and we really look forward to working with all of you and debating and discussing the merits of this report and how it can be implemented across the Council of Europe nations.
How hopeful are you that now that the report, your report, has been adopted, it will make a difference and change things? And if so, very briefly, in what way?
I mean, the proof of the pudding will be in the eating, to be frank. So it really is down to, you know, myself and others who have been involved in this process to do the rounds and to work with those nations. And let's not forget, there are so many organisations and so many nations already leading the charge on this, and an incredible amount of work being done. But the Council of Europe is an incredibly important organisation. You know, and human rights and democracy are the founding principles. And particularly for the UK, now that, you know, the UK is leaving the EU, the Council of Europe becomes even more important, to be blunt. And I would like to think that the amount of support I've had, particularly from Joe O'Reilly from Ireland, who has put forward a number of amendments on this from the Social Affairs and Health Committee. They've been really helpful and very positive. And I know that there are a number of members in the Council of Europe individually who are champions and passionate about this issue, as am I. And so I am confident that given the support it has received, that when it comes down to practicalities of implementing this, you know, we have had the war on drugs and we know it has failed. And I think the impact, I hope, will be akin to the kinds of things that we have seen in places like Portugal, where they have had a significant reduction from both a crime perspective and a health perspective. And it just proves that if you approach it from a health and human rights perspective and give people the support, the right environment and the tools, then they will hopefully not fall into the same cycles that folk often do. And so, you know, I'm very hopeful and I'm very positive, because at the end of the day, this is about people's lives, and it's about not stigmatizing, and particularly marginalized groups, you know, women, folk from the Black minority ethnic communities, LGBT communities, who often suffer the worst. And that's something that has been discussed a lot and that we highlight in the report. It's really, really important that there's a level playing field and that we lift everybody up and make sure that where people do fall on very difficult times following COVID, we know, you know, levels of poverty are increasing significantly, that now more than ever this policy is required, and it's absolutely essential.
Hannah Bardell, thank you very much indeed.
Thank you.
Okay, I'm going to stop the recording now.